Oven Podcast. Your table is ready. You can follow me.
What up, guys? Man, tonight's a special night. We're back at home. We're at Jackson's in Comac. Our first live audience. We're about to share this infused meal with everyone. We're sitting down with physician assistant Morgan Smyth. She's also a licensed medical cannabis prescriber. The oven's preheated, so let's get going.
All right, Morgan, thanks for joining us.
Thank you for having me.
Night here. You got it. First time with a live audience. Thanks for coming, guys.
Yeah, seriously, guys. Thank you for coming.
And
we got a birthday in the crew.
Happy birthday.
First time. I love it.
So we're mixing things up tonight, obviously, live audience, but we left pen and paper on your tables. We usually do an oven question at the end where we pull a question. The guest has no idea what's coming out at the end. Some are spicy, some are mild.
Mostly
you can ask
spicy.
whatever you want, mostly spicy. But if you guys want to rip off paper and, ask a question, at the break, we'll throw everything in the oven, and we'll choose one for her to answer at the end.
Oh my God.
All right?
For everyone to answer at the end.
All right, so why don't we start just by telling us, for those who don't know out there, the difference between a physician assistant or PA and a doctor.
Okay.
What's the difference?
So a physician assistant is a licensed medical provider who is trained and educated to treat patients, evaluate patients, and perform procedures, review diagnostic imaging, stuff like that. Pretty much everything a doctor can do, they just have to work with a doctor as a supervising physician. Obviously, every state varies in terms of legislator what supervising means. So I believe for the state of New York, a doctor kind of has to be on site. And really, the only limitations for PAs is you can't perform surgery by yourself. You can't open your own practice, but pretty much everything else. I mean, they could put in A-lines, central lines, first assistant surgery. They can see patients on their own. They can't really own their own practice, but they can run, a practice by themselves without the guidance of a doctor, unless the doctor needs them to. But it's pretty liberal here. So
I didn't actually know you can get into surgeries like that.
yeah.
It's interesting. Yeah. It's actually really cool.
Yeah.
I've worked with some really brilliant PAs.
Yeah.
I know there's so much bias, especially for, uneducated patients who think that, I need to see a doctor. I need to see a doctor.
Yeah.
So, my background in the healthcare field, I got to ask you, how many times when you walk in the room do you hear, "Oh, are you the nurse?"
Yeah, or when are you finishing with school? That's like number one, Every PA across the board has heard that question. So
Right.
it's also like limiting as a woman too. And, most doctors are seen as male, nurses are seen as female. So it's sometimes difficult to break the mold, but, we're getting there. So
We're trying to break the stigma
Exactly.
all around here.
That's
Exactly.
it.
Cannabis,
That's it.
PAs.
Exactly. Exactly.
So, what advice do you have for new PAs, or especially females, who are looking to get that respect or are trying to get into the healthcare field? What advice would you give them?
Honestly, the best advice I can give is just to get as much information as possible, educate yourself the most that you can possibly get, because everybody is going to say something to you, whether it be a doctor, a surgeon, someone who has nothing to do with anything that you're doing, an administrator, staff, even a patient can say it. So you have to back it up with your own knowledge and just be an advocate for yourself at all times and have your own back. I mean, there are people who are going to have your back in any profession, but for you yourself, your knowledge, trust your gut, do what you got to do. The patient comes first, and you always treat the patient with the utmost respect, and you treat them all the same and give them as much respect as possible, and you receive it right back.
Right. Nobody owes you anything. You got to earn
Exactly.
it. That's the best way to go about it. So
That's
how long have you been a PA?
Almost 8 years. I've been doing it since 2015. Yeah.
So how many? 8?
8. Yep.
God
Almost
damn.
8. Yep. It's like 7.5 now.
Okay.
Yeah.
Well, okay. So do you, what's the one particular story or experience with a
Oh my
patient?
God.
He's starting you off early
Yeah,
with that. He's starting you off
One
early with
particular.
that.
What about one particular today?
You can go with that one particular
Yeah,
today.
I mean, I get yelled at all the time. I don't know. I had a patient. So at my office, I do family medicine right now. I used to do spine surgery. I worked in urgent care for a little bit. So right now I do family medicine, and it
sounds like family
It's
medicine.
good. I love it, but it's It's a lot sometimes. So I had a patient, we do a lot of controlled substances for patients at times, and they've been on it for years, and it's kind of something that like I've absorbed and I didn't really want to absorb at all times. But we had a few patients where now when I took it over, I was like very strict. I'm like, everybody's got to leave a urine, everybody's got to do a drug screen, everybody's got to they have to sign a waiver, you have to come in for your appointments, you have to do this. Like, I'm very strict. So we had a patient who I swear he was doing like lines of coke in the bathroom because like he would just not leave a urine. And you would hear like, I don't know, rumbling and stuff like that. And then he'd come out like sniffing and stuff. It was a lot. So then we go. And
What was he there for?
Pain medication. And I think like Adderall or something, which I don't know why you need Adderall.
He's got cocaine.
But
Well, when you're down, you need help.
yeah, right? I mean, I don't know. I don't know. I don't know about that. But so we ran his urine and it came out positive for like cocaine and it came out positive for fentanyl. So I had to like sit him down and have a conversation. He was like a little dense, which is, you know, whatever. But I sat him down and I'm like, listen, we can't continue to write these medications for you. You need to, see other providers, blah, blah, blah. Because your urine tested positive for cocaine and fentanyl. And he's like, what do you mean? And I'm like,
how else do I say that?
I repeated myself in like a different way.
I only ordered cocaine.
No, that's literally what he said. He goes, I don't do fentanyl. And I'm like,
That's what he said.
yeah. He goes, I don't do fentanyl. And I'm like, you're kind of missing the point.
Oh my God.
Believe it or not, you can't trust your drug dealer.
I mean, and it was like a lot. I was like, this is a problem.
And when was this?
This is like last year.
Oh, I thought this was like yesterday.
Yeah, to the point where like, I was so happy to get rid of this guy too. I was like, you got to go elsewhere because he was like, come on.
I used to work pain management in Baltimore.
Yeah.
And that was an experience, dude.
Did you?
Yeah.
The Wire.
When I was at
Yeah, I didn't know.
Yeah.
Prove it. No, so
Bubbles over here.
my last semester at school, it was an internship, and I worked at a pain management practice, and we would get these new patients that would come in, and as soon as we handed them the urine cup, they would go in the bathroom, put the cup down, say they forgot something in the car, and then not come back.
Yeah, I had that too.
We've had, same thing. It was interventional, so we did a lot of like trigger point injections, like alternative, to pain medication.
Yeah.
And it was really rewarding when it did work and you did
Yeah.
see someone walk out of there, with no pain. Pain that they've been dealing with for the last decade sometimes.
Yeah.
But we did have some crazy patients. One time we had to shut the office down. Some guy called and was like, yeah, I'm going to come and shoot all of you. I'm like, come on.
Like, all right,
I
man.
believe
Hold
it.
on with that.
Yeah.
Have you ever like caught someone like faking a drug test?
No, but I've had people where I'm like, you need to leave a drug test, or they'll like leave and come back. I'm like, that's not how it works. Like, you can't just leave and then come back. Like, I wasn't born yesterday. Come on.
I was actually working with a kid. We had to get drug tested for one of the jobs that we were on. And I had no idea about this. He came with me and another guy. We're sitting in the waiting room and he's sitting like proper. Out of nowhere, his whole right leg is just soaked.
Leaking?
He had a Ziploc bag full of piss that opened up and he just ran out to the truck and laid in the back of the truck like no one was going to find him. I looked at him like, first off, why a Ziploc bag?
Yeah.
Like, bring a sprinkles jar if you want to do that. Are you kidding me?
Well, they make the fake dicks too, don't they?
Yeah, like on Entourage.
But like, you don't even need that though, because like you're going into a place like that's not even going in with you.
Right.
Yeah, we don't have people going in with them, so I'm like, all right, what's like with the?
I'm not trying to tell you how to pass the drug test.
I mean,
here,
yeah, like please don't do that.
So, where is your current practice now?
So currently, I work in Freeport.
Okay.
We do family med in Freeport. We also, my boss has a other office. They do like holistic medicine, so like the trigger point injections, and they give out the medical marijuana cards as well. So
Okay.
that's
So
kind of
piggyback off the medical marijuana cards.
Exactly.
You're licensed to prescribe medical marijuana,
certified
correct?
to prescribe. Yep.
That's fucking sick.
So, what made you want to become a licensed prescriber?
I mean, honestly, I didn't really think about it until I started working on my current job because I never really got exposed to it. It was kind of on the newer end. obviously when marijuana got legalized for recreational and medical use, everything kind of changed. But I started doing the evaluations for the patients to get the certification. So then I kind of was like, all right, let me think about getting it myself because, if my boss is not here or, someone needs it, it's a good way to, keep business going also. Plus, I mean, like as a provider, it's important to know, so I see so many people that you would not expect who test positive for marijuana and that, that's, neither here or there at this point, but it's important to know that if somebody's taking something like that and they have, a medical problem or they come in with a complaint, that you understand, the mechanism of action for the drug and, it can mask certain symptoms of, something they may have or they could have a side effect from it. It's good to, keep that in mind for people. That way you open up your differential and make sure that you're taking everything into consideration when you're treating them, The more information, the better.
You have like any examples of that? Like where pot might have like masked something for somebody or?
Like if you have IBS or if you have even chronic pain too, it decreases inflammation. So it can decrease those symptoms where if a patient's coming in, they're like, oh, well, my pain's not that bad, but, like I'm having a lot of diarrhea or something like that, or I'm having a lot of, watery bowels, whatever. And but are you having stomach pain? Are you having this? And they're like, well, not really. You don't think about it sometimes. And then you have to do a little digging, and that's medicine in general, honestly.
Yeah.
It's like detective work, but you kind of have to check them all out. You have to treat the whole patient. You can't treat just, what they come in for. You got to figure out what's going on total. A patient has cancer or something like that. You don't just treat the cancer, you treat the symptoms that go with the cancer or like what can happen if they have cancer. They become depressed, they have anxiousness, whatever. You got to figure it out completely. That's part of medicine in general. That's part of being a good provider in just having a good rapport with your patient too.
And it's important, for people to understand, you want to be a good patient too.
Exactly.
You have to be, find a provider, a doctor that you trust, and that you think is providing you good care. And when you go there, you got to be an open book so they can, give you the care that, that you need.
Yeah.
And that's important too.
It's hard. Patients are not very honest sometimes. They think that like you're going to judge them or,
you're going to tell their parents.
You're going to hold something against them. But like, I'm not here for that. I'm here to help you. So the more information I have, the better.
Yep.
I'm part of me helping you is, you respect me, I respect you. And, I treat you the way I tell patients all the time, like, if you were my dad, I would do this for you. I would do the same exact thing. If you were my mom, I would do X, Y, and Z for you. If you're my family member, I would do that for you. So.
Yeah, the only difference is you can't smack your patients when they're being a stupid patient.
Yeah, I mean, like, I think when you say that to them too, they're like, okay, like, she's trying to help me, you know what I mean? She's not, like, coming for me, she wants me to get better, prevent something, whatever, so.
One time, my dad, he fainted in the middle of the night.
Yeah.
He was, like, altered mental status. He was, like, speaking gibberish. And my mom's like, yeah, she called me right away. She's like, yeah, no, he's feeling better now. I think we're just going to go to sleep. I'm like, no, you're going to go to the hospital. I'm not even a clinician. I just work in the field. I'm like, no, that's a bad idea. You need to go right away.
Yeah.
I feel like a lot of people would come out now and tell you though, like that they're smoking.
Yeah.
Right?
They
like,
do.
It's a little different.
Honestly, people you wouldn't expect.
Oh, yeah.
Thank you. Honestly, people you would not expect
Thank
too.
you.
Like, we do urine toxicities on our patients for like Adderall, even Xanax, stuff like that. And these people come in, I'm like, like 80-year-old guy.
Yep.
He's, you would never expect it. And then he tests positive. I'm like, all right, well, good on you. You know what I mean? If it helps you, it helps you,
I mean, growing up, I would never tell my doctor. But I had one
Yeah.
doctor look at me. She's like, do you smoke? I was like, smoke what? And she just started writing in her book. I'm like, fuck, she got me, that lady.
You can tell sometimes.
Yeah.
Oh, so you're judging?
No, I mean, like,
I'm kidding, I'm
you
kidding.
pick up on cues, you know what I mean? It's like when you tell if someone's an alcoholic.
All right, those wings were too good. We had to get off the air, but, to enjoy those. But we had some garlic parm wings, and the garlic parm sauce was infused. So I'm going to give it up for Franco on this one.
Thank you. Hey, so
you
just to piggyback on the medical cannabis, you know,
Mhm.
what? So obviously the field is now medical and recreational.
Mhm.
So do you see any like big differences between the two?
Not really. I've heard patients say that if you have this is going to sound kind of bad.
I can't wait.
If you have the certification and you go to the dispensary, it's like not good of a strain, but if you buy it, you know, on your own, it's a little bit better. I don't know. I guess maybe because it's government regulated. I don't know how true that is, but
No, right. I mean, the potency tax is humongous right now.
Yeah.
They're charging you per milligram.
yeah.
Like they're taxing you heavier per milligram.
Mhm.
So it's like if you want the better bud, you know,
Might as
stick
well just go,
stick
yeah.
to the black market kind of thing.
Yeah.
But you know, and coming from your shoes, you're the one prescribing it.
Mhm.
So you know, where exactly is that? You know, where's that coming from?
I guess people are not really inclined to spend more. You know, they want to spend what they're used to spending, what they
Yep.
used to have.
What they're comfortable with.
Exactly. And they're used to having as much as they used to have. You know, and they're using it more for recreational use.
Mhm.
I mean, I don't know if there's a big difference.
Well, who was ever really willing to pay more for the same product? Or even
yeah.
in this case, a product that's not as potent.
Yeah, that goes to the government too.
Right.
You know what I mean? Like it's kind of.
The potency
Gotcha.
tax is a really
Yeah.
big problem over here right now.
And there's not that many dispensaries. I think there's like one in like Albany. There's 2 in the city. There's not that many. So like
Yep.
for availability, you know, New York is a huge state. So like if you're not have access to dispensary, you're not going there. That's for sure.
Yeah.
You know?
I mean, some of my friends go like to Boston for it. I'm like,
Yeah.
what are you doing taking a 4-hour drive for flour
Yeah.
that you can get anywhere?
You can get it, you know.
Like literally down the street, you can
Yeah,
get it.
exactly.
But like, what do you think is the biggest like benefit from medical cannabis?
I mean, it decreases inflammation. It helps with people with sleeping, with anxiety. You know, people feel it's a good alternative to, you know, some, you know, other remedies where people will go down. Obviously, there's an addictive quality, so everything has to be taken in stride. I think there's always everything, and nothing is without risk. So everything has
Mhm.
benefits to it. I think the benefits definitely outweigh the risk on some of the stuff that it's used for. You just have to be mindful, especially when you're a provider or you're, you know, seeking medical marijuana, because if you're over a certain age, everything will affect you differently. If you have different medical problems, things will affect you differently. I think that what it's used for, especially when you get the certification for medical marijuana, people have really good results with it.
Right.
You know, even like the CBD, stuff like that, they use it in epilepsy. So, you know, patients have seen good results kind of across the board on most things. So everything has to be done in stride though. I mean, like if you do an excess of anything, you're going to have problems. So that's, you know, if you take an excess of Tylenol, you're going to have the same problem too.
Mhm.
So
Yeah, patients love thinking, you know, again, I'm not a clinician,
Yeah.
but I've worked in the healthcare field before. They love thinking that everything is one size
Yeah.
fits all.
it's true.
You know, and you as a clinician,
Yeah.
you understand, you know, everyone's metabolism,
Mm.
their genetics, it can play a role in
Yeah.
how they're affected by different things.
Yeah.
For example, you know, just for ease of everyone understanding, you know, when you have a patient who's a diabetic
Mhm.
and they come and you're treating them,
Yeah.
how much of a curveball that when you're trying to figure out what medication they can take, not only does it interact with their other medications,
Yeah.
but how does it interact with their blood sugar?
Yeah, it's
You know,
true.
patients don't understand that kind of stuff.
No. And here's the thing too. I mean, what works for one doesn't work for all, and it's also like it's like a guessing game sometimes. You don't know what's going to work for somebody. You don't know what's not going to work for somebody. If somebody's, you know, blood pressure is well regulated, but they don't feel well on it, you have to change it. You can't just be like, all right, I don't care. I mean, your blood pressure's fine. If they don't feel good, they can't do certain things that they like to do. If they can't get up in the morning, you know, if they're having fatigue, stuff like that, or they just don't feel well on it and they're not themselves, you have to take that into consideration and you have to listen to them and to change it. Nothing is a cure-all and nothing is, you know, you got to play around with stuff, and that's, you know.
It's kind of what they're doing now.
Yeah.
Right.
So everything.
You said an addictive like quality
Yeah.
to marijuana.
Yeah.
So like, you know, all my buddies who smoke,
Mhm.
anyone I've ever smoked with, they're like, you can't get addicted to pot. Like, what would that like addiction be like?
There's like a 10%, I think is a percentage, like physical addiction to it, which I guess is like, it's all you think about and it's like all you want to do, and
You can't eat without it, kind of.
yeah. it's obviously better than, alternatives, like heroin or something like that. But I mean, you have to consider that if somebody has an addictive nature already, if they're a recovering alcoholic or something like that, you have to put that into perspective also, because what they could be addicted to in one instance, they could be addicted to another, and then they're not listening to you when you're telling them to do something the right way. They're doing it on their own, and they're like, I know better, I know myself, plus I have this addictive nature where that's going to supersede any logic. So
okay. I mean, I'm happy you brought up the alcohol part,
Yeah.
because pot's been on the back burner forever, and alcohol's been legal for forever now at this point. So it's like, obviously you would rather your patient be an everyday smoker rather than a drinker. I want them to know. I want everyone to know.
Say it.
Listen, I mean, it has better healing properties than alcohol. Alcohol is like basically poison, but I mean, I can see why people enjoy both, and I can see it, but for recreational use. But
as she walks in with 5 JMO. Literally. Thank you for that, Shelby.
Yeah, right?
That's perfect. But no, so you would rather, all in all, you'd say, I don't want to make you say yes, but I kind of want to hear it come from your mouth.
I mean, yeah, like alcoholism contributes to like end organ failure in a lot of people, especially when they're, everyday drinkers, stuff like that. It's stuff that you don't realize. Everybody hears like, you have alcohol affects your liver. It affects really every organ. Marijuana also affects most organs, but you have to, there's good components where it affects it, and there's bad components. Obviously, if you have COPD, asthma, stuff like that, and you're smoking every day as opposed to like ingesting it other ways, there's risk with it.
Well, you can enjoy an infused
meal. But if you're exactly, or you take a suppository or something like that, and whatever you want. I mean, there's like oil, there's stuff like that. There's even like nasal spray, stuff like that.
Yeah, there's everything now. But you also brought up, holistic medicine. Mm-hmm. So how does, pot go hand in hand with that?
Well, obviously, pot is grown and it's all natural. But I mean, in terms of like pain management, it's good with, turmeric, stuff like that. It helps decrease inflammation. Everybody's, there's different research on different, type of herbals or different supplements you can take to decrease that. I mean, there's a lot, it's kind of touchy. I mean, because herbals are not really, or holistic type of medications are not really studied as broadly. I mean, marijuana is definitely studied a lot more than any of those things.
Especially now.
It's hard to get information on them to, here are the facts, you know what I mean? But.
Well, Big Pharma doesn't really like studying anything that is made from the earth because they can't make money
they can't
off
profit
of things.
Off of it.
Right,
exactly. Yeah.
Yeah?
Yeah, that's the thing.
I mean, that's the reality of,
Really?
Life
all
here.
right. We're learning here tonight. I love it. That's kind of crazy. So nothing that's grown, they can't capitalize on that.
I mean, you can't like FDA approve of it, which means that like they test on it, they put their stamp of approval on it, and then they have the ability to profit off of it as well.
Okay. I feel like being FDA approved there's so many loopholes now. Like, can you just put like a diet, it's like a dietary supplement, and you're like technically FDA approved, like on the label?
I don't know about that.
We were trying to come up with something the other day, and I looked it up. I was like, wait a second, we can go through that. Like,
you're starting to get outside of her expertise.
That's completely out of my scope. I mean,
I'm trying to
I don't mess with the government too much.
So we talked about your craziest patient interaction, but what about like patient interaction, like, dealing with pot?
Mm-hmm. Like in terms of somebody who wants to get it?
Or like, have you ever had like someone come in and like a bunch of my buddies are cops and they tell us stories like someone eats too many edibles?
I had a patient one time and he got a medical marijuana certification from our office, and he actually went into psychosis because he was definitely like taking a lot of marijuana. Like I don't remember how much milligrams or whatever he said, but he was smoking like around the clock basically, and he had like altered mental status. He had like severe nausea, stuff like that.
Jeez.
To the point where we went to the emergency room. They couldn't really find a source. They just called it like toxicosis from it. And then he came out to the office for, hospital discharge, which, I just check and make sure everything's okay, whatever, go through any changes, whatever. And he was like, okay, so like, when can I resume? And I'm like, this put you in the hospital. I was like, maybe give yourself a break because, you build a tolerance to it. They do recommend that if you're on it too, that you take at least a 6-week break to try to lower your tolerance also. And that, helps with kind of resetting everything too. And he was just like, okay, but like, when can I restart? And I'm like, sir.
Relax for a second.
Like, you were just in the hospital. Like, you weren't there for like a couple days. You weren't there for like 5 minutes. Like, that's a little traumatizing. I don't know. I mean, people will want to do what they're going to do anyway. So you can't really, you just say what you got to say. And you're like, this is what I recommend. And, do what you want with the information, but that's it,
You can't tell me those crazy stories when I'm eating an infused meal.
Yeah.
I'm like, I don't want to somebody else's.
I mean, this guy, I think he was like, I don't know. He said something like it was a lot. I was like, all right, maybe tone it back. Like, like, what are you even taking this for?
Yeah, relax for a second. We're good.
The patient stories and like them like wanting to get back into it.
Yeah.
This has nothing to do with cannabis. Yeah. This has to do with sex. But so I worked in a call center and I used to relay STD results to patients. Like I'd be the guy that would call and be like, hey, like you have the clap.
Like, say it again? Do that again?
So like, when you're letting them know that they have like chlamydia or gonorrhea, like you're like, okay, take your medication and you want to abstain for 7 days. And right away, the guys always be like, but can I jerk off? I'm like, take a break. Like,
calm down. This is what got you here in the first place.
Oh man, I had this one guy. He was actually a cop, and I was a manager of an urgent care.
They loved you over there, too.
We don't shut up.
Cut that.
So,
put a little bleep over that one.
So, he comes in asking for the manager, and here I come. Like, I was a new assistant manager at the time. I was, like, nervous every fucking day. And he's like, hey, can I talk to you for a second? So I'm like, yeah, sure. So I bring him back to the exam room. I close the door. I turn around right away. Boom. He flashes his badge. I'm like, what the fuck did I do? I thought I was in trouble. He's like, listen, I'm a cop. He's like, I got tested here a couple months ago and I need you to change my results. I'm like, what? I can't do that. He had herpes. Okay.
That's why he needed those.
He's like, listen, I'm a good guy. He's like, I got a wife, I got kids, and I don't want to show this result to my girlfriend. I was like,
what?
I was like, wait a second. So you got a wife and kids and you don't want to show this to your girlfriend. I was like, he wanted to make it seem like the girlfriend, he wanted me to change the date on the herpes results. So that the girlfriend thought that she gave him herpes.
So she wouldn't bring it up.
Yeah. So she wouldn't, yeah. Crazy.
Very, very sneaky,
Men are
sir.
fucked up.
No, that's fucked. That's bad.
Oh.
I mean, so obviously you guys got some crazy stories. You do some crazy stuff. You're like, what made you want to get into this?
Medicine?
Yeah.
I don't really know, honestly. My cousin's a PA, my sister's a PA, she's here too. But when I was in high school, I had thought about it. I was like, I always wanted to be a nurse or something.
Where was high school?
North Babylon.
North Babylon? All right.
I wanted to be a nurse, and I remember my aunt being like, you don't want to be a nurse. Like, nothing against nurses, but she was like, she goes, medicine has changed over the last few years, and you don't want to be she's like, she was asking me what I wanted to do specifically, and I was like, I kind of want to like treat patients, like be a doctor, blah, blah, blah. She's like, if you want to be a nurse, you're not going to be doing any of that. She's like, you can do a lot, but you can't do that. And I was like, all right. She's like, what about a nurse practitioner? And I was like, all right. And then I like read into it. And for that, you have to be a nurse first. So you have to basically go to school to be a nurse. And some programs require you to actually work as a nurse before you get accepted. So it was a lot of like time, whatever. And my other aunt was like, my cousin Mary Ellen, she's a PA. She was like, why don't you do that? And I was like, oh, I never even heard of that. It's like so weird.
It's like a lot of
she's in
people
my
have it.
family. I'm like, I don't even know what that is. And I looked it up and I went to the same school. This is like I made a decision I made like when I was 17. Like I went to school, I got accepted right into the program. It was accelerated and I was I just had to maintain grades, and as soon as I did all that, I was able to graduate. And it's very difficult now if you don't do that to become a PA, because it's very competitive and it's hard to get into the school. Everybody now, since COVID and all that stuff, everybody kind of wants to do PA and they want to be a PA, and nobody really wants to be medical doctors as much anymore.
Yep.
Well, I mean, because just from a logistics standpoint,
Yeah.
if you can spend less money,
Yes.
go to less schooling, and the most of the liability is on the doctor who signs
It's
off on the
true.
paperwork.
Yeah. And also,
If your goal is to truly just treat
Sign me up.
patients,
Yeah.
what else?
Why wouldn't
it's
you
a
pick
steal.
that? Yeah, I would honestly promote anybody to do it. If you have an interest in it, go do it. Especially like they don't tell you this. If you're a doctor, you need to be very good in business, because the way you make your revenue is all billing. And if you don't know how to do certain things or whatever, or even like run a practice, it's all business.
Right.
90% of it is business. I mean, like most of the doctors are not even, unless they're, employed somewhere or they work for a hospital or something and they're just an employee, they just do their job. Most of them make their money from their private practice, and it's all just on a business end. And they don't tell you that. You don't know that going into it. You're like, oh, I'm going to, come out of medical school. I'm going to like start, out of residency. I'm going to start working, blah, blah, blah. It's not like that anymore.
People don't realize how much malpractice insurance costs.
Yeah.
People don't realize how every year the insurance companies never pay the doctor more. Their
No.
contracts always shrink and shrink and shrink.
No.
And the payout that the insurance companies are giving these doctors are less and less.
Yeah.
It's a shame. And that's why you even see some hospitals, some doctors doing unnecessary tests and unnecessary procedures to get more money. It's sad that it's come to that.
Yeah,
But
it's true.
To get more money, you saying?
yeah.
Damn. It's almost like being like a mechanic.
Let me picture your air filter.
Always, never fails. You go for an oil change. Oh, you want to change your air filter too?
Yeah.
They bring it out.
They
They
like
make
bring
you
it
look
out.
at it.
They're
every
like,
time.
oh, look at this. I'm like, I don't know what the hell that is.
It's like they have a pail of dust and they just dip it in and be like, oh,
You missed it. Everyone ready to eat steak tacos? Yeah?
I'm
right.
so excited for these times.
I can't wait for these tacos.
You're listening to the Oven Podcast. Thanks for tuning in.
All right.
All right, man. Those steak tacos were fucking something. How did everyone like those steak tacos? Good?
Good.
Yeah? All right. So we've had so many people with Pop Water come up to us with NYPB, and they're like, we want to get into the healthy side of things.
Mm-hmm.
So, we do nano infusion, which is like a powder.
Okay.
We also like infuse agave, so it's like a little substitute. But, what are your thoughts on like the fad diets, like a keto or a lion?
I know. Do you know what a lion diet is? I've never
The
heard of that.
lion diet's like just a straight meat, right?
Yeah, it's like meat,
Oh, like
salt.
paleo or
Yeah,
whatever.
It's just like, it's
Just
straight
meat.
up just ruminant animals. So like anything with a hoof, basically.
Yeah.
Oh my
That
God.
meat and salt and water.
I feel like a lot of people are doing that diet now.
I tried it. It crushed my stomach.
Yeah, I heard
I
the
mean,
first 2
yeah,
weeks
like-
on your stomach is rough.
I was in pain. I had to stop. I quit. I was like, fuck
You
that.
need a vegetable. I mean, like,
Yeah, right, not just
like,
meat.
I mean, the keto. I'm not a fan of the keto diet. I mean, like, even that diet, the lion diet. That
Why aren't
sounds
you a fan of the
awful.
keto diet?
Well, I mean, I think it's good. So my uncle and my aunt actually went on it, and they lost maybe 30 pounds each, and they did really well. I think it's a good start, but the way it's designed is that you replace any carbohydrate with fat, and then in order to meet your macros, you start doubling up on fat. And that's fat is good for you in a sense, but it's also really bad. So long term, it's not a good thing. It's good, I guess, short term. But here's the thing too, if you're more prone to a fatty liver or something like that, and you don't get that checked, or you drink a lot of alcohol or something like that, that is gonna, and you're on this for years, it's gonna cause long-term problems that you're not aware of. It can cause cirrhosis, stuff like that. You have to be aware of what you're doing. You can't just be oh, well, I lost 20 pounds, I feel great. Yeah, you're destroying your insides.
Yeah, I guess
at
that
the
good
same
weight.
time. Yeah, even with the Lion diet, high protein is good, but your brain needs glucose, your brain needs sugar in order to function properly. So if you're not getting those nutrients that you're supposed to, you're not supplying your organs properly. You're not supplying your body properly. It has to be well balanced.
Right.
Yeah.
So I guess that also is another reason why it's important to, make sure you're seeing your doctor. You're letting
Yeah.
them know, like, if you're trying some sort of restrictive diet, let them know what's going on.
Yeah.
And, as long as you're going and getting your physicals, annual physical, if you're feeling something out of the norm, you're going to get it checked out. In that case, if you're looking at your numbers, your blood work, if everything's okay, is it okay to continue with a diet like that?
Yeah, I would just proceed with caution because anything can change, obviously.
Right.
Honestly, the diets are more like it's just a calorie deficit. That's basically the bottom line of what it is, and that's the way it works. I mean, diets don't work long term. They don't work really for anybody long term. They help you lose weight, and then losing weight is great. Listen, I'm okay with it, but to keep it off and to maintain it, it's
A whole nother story, right?
different, and you have to completely change your entire lifestyle to maintain that. You can't just be like, all right, well, I'm going to eat a stick of butter because, it fits my macros, and then
Eat a stick of butter.
Pop butter. Stick of pop butter. You'd be on the move.
Yeah, exactly.
What about intermittent fasting? How do you feel about that?
I'm okay with it because it's the same concept. You're in a calorie deficit. So, I mean, if it works for you, it works for you. I mean, if that's the way you lose weight and it works for you, works for your lifestyle, and you're able to stick to it, that's great. I mean, everybody's different. So,
I have a buddy right now who's going to be watching this
Yeah.
episode, Sano. His eyes are lighting up that you're saying calorie deficit. Yeah,
That's how
no,
you
because
lose
I'm
weight.
a big low carb guy.
Yeah.
Like, I don't lose weight unless I go low carb. He's
Yeah.
like, bro, eat whatever you want, just
Yeah.
eat less, calorie deficit.
Yeah.
So there you go, Sano.
Shout out to you.
I want to jump back into the prescribing aspect.
Yes.
Of it. I know a lot of people, especially nowadays, are weary where, these clinicians or their doctors are getting this information from. Why are they treating me with the medications that they're treating me with? Why are they recommending this vaccine? So when it comes to the information that you as a prescriber receive about cannabis, who is this coming from?
So for New York State, it's Office of Cannabis Management. They kind of oversee everything. Honestly, to be licensed prescriber, you have to go through a little bit of guidelines. Also, you can't just show up one day and be like, I want to do it. You have to, if you're a mid-level practitioner, PA, nurse practitioner, you need to have a supervising doctor who has a valid DEA and is also a medical marijuana prescriber. You yourself have to have a valid DEA.
When you say valid DEA, you mean when it comes to a clinician, that's you
can prescribe
a license
narcotics.
to prescribe narcotics.
Or controlled substances,
I just want to
rather.
clarify
Yeah.
that for the listeners.
Yes. So, and that's
And for me.
any scheduled, that's scheduled medication. So to be in good standing with it, you have to pay for it. You can't have any nicks against you, basically. You can't have it taken away. So as a prescriber, you need to have that. And then for New York State, you have to take a 2-hour course. And then for New York State, you also have to take which is just medical marijuana information. And then for New York State, you have to take a supplementary course, which is, I think, an hour maybe. And it just goes through New York guidelines. So all that information comes directly from New York State and the Office of Cannabis Management. But they set the guidelines. They grant you access. You have to, everything gets submitted on their website. So it's not
They're the end all be all.
yes.
For
So
all of
you
it.
can't just here's a card.
Yeah.
The way they get the
Yeah.
card is through them. And it's actually interesting too, because recently, I think within the last couple of weeks, so I guess back in the day also, within the last few weeks prior to, I guess the middle of March, if a patient got a certification to get medical marijuana, they received a temporary license. And then from there, they get the other official one sent to them in the mail. But the temporary one takes about 7 to 10 days.
Okay.
So once you get the temporary one, you can go to the dispensary. So before that, you really couldn't go. Now it's automatic from an email I received that if you get it done in the office and you get certified, the temporary certification goes directly to the dispensary. So a patient can go that day
really?
to receive
Okay.
it. Yeah. So either the patient can sign up for it, a caregiver, like if they're a minor or they're, elderly, whatever, and they can't prescribe it themselves or take it themselves. Or if you even want to grow it, you can get authorization to do that also.
Can you explain the caregiver a little bit more?
So from my understanding, a caregiver can be really anybody. If you're under 18 years of age, you have to have a caregiver give it. So minors, there are certain cases where medical marijuana is prescribed to minors, like epilepsy, stuff like that, where the minor themselves cannot pick it up. That's where the limitation is. Obviously, like a 3-year-old who has a seizure disorder is not going to go to the dispensary and pick it up. But their mother, their guardian, whoever is going to go pick it up for them. And that's where the caregiver signs up. I believe that you need the patient's information, the caregiver's information. Everybody has to show their license. They have to have a valid New York State license, or they have to be living within New York State to obtain it, and be the patient or the caregiver. And then you have basically full access.
Okay.
Yeah. It's kind of interesting.
So, how do they come up with these guidelines? What kind of, procedures do they have on their end? Where are they pulling this information from that they are then digesting, forming, and putting together to release to clinicians like yourself?
I think it's just based on general research that they've done. I know that the dispensaries have pharmacists on staff who will, a patient comes in and they're supposed to get medication interaction checks, stuff like that. They provide guidance for it. From what I understand, there's a lot of research, and I think it's also based on for New York State to be a prescriber, they have to follow a certain diagnosis also. So there's a limitation on that. You can't just be I have high blood pressure and I need medical marijuana. You have to have a certain diagnosis and whatever. And they're the ones who pick those diagnoses. I believe it's based on, where they find the benefit, where the patient can find the benefit, or, it's been researched where you can get either disease improvement or symptom improvement. It works in cancer. It can help with cancer treatment, where it just destroys some cancer cells. It has been proven to destroy cancer cells. It also helps with the symptoms of cancer, obviously the nausea from chemotherapy, also patients after chemotherapy are, just generally not feeling well. They don't have a good appetite, or they're losing weight, stuff like that. Yep. It can help with.
Speaking of chemotherapy, just to go back to what you said about how the new legislation or the new guidelines allow for no delay in that temporary card when you're waiting to get your actual medical marijuana card. When you're dealing with an acute illness, or a symptom that's acute, meaning you're experiencing it right now, in 7 days, that card's not going to help me. If I can get that license or be able to, have that relief of my symptoms right now, that's going to benefit a lot of people. That delay in care is crucial for a lot of symptoms.
Especially for diagnosis like anxiety or insomnia, stuff like that, where it's used for, even Parkinson's disease that it's used for, ALS, stuff like that, where it gets progressively worse, and it gets progressively worse with time. So if there's any delay, if there's a delay with, say you don't have the patient's right P.O. box or their address that you want it sent to, and there's a delay, or they have the wrong name or whatever, or they're not, a resident, whatever, and there's any delay, the 7 days can become, 30. It could be 60. It could become 3 months, and then a patient's left without treatment. So that's, that's important that they did that. That's pretty helpful, honestly. And it's pretty interesting. It's pretty cool that they did that, to be fair.
And delay in care, it drives me crazy.
Yeah.
For me, I hate copays. Okay.
Hey, you're not alone.
I hate copays. I know that the majority of offices, if whoever doesn't understand what a copay is what you're responsible paying each time you visit a doctor, right? And you're responsible for paying that at the time of your visit.
Yes.
And it drives me crazy thinking that there might be children or people who are very sick who are going to say to themselves, I don't have that $50 in my pocket today, so I'm not going to go to the doctor. Yeah. A lot of offices will be like, okay, we'll bill you.
You can wait.
But they're not obligated to do that. It's technically if you're required to give it.
It's illegal to do it. Yeah.
Right.
Yeah.
Or waiving copays. When your provider waives a copay, they then hear it from the insurance companies,
Yeah.
you know, because they're technically breaking contract with that insurance company by not collecting that copay.
It's true. You, as a provider, you can't be like, listen, we're going to waive your copay because you're my friend or something like that. Like, that's a legal thing that you have to pay. There is a way you can get around it if you do have like a hardship or something like that. You can file for a hardship, whatever. It's difficult. There's limitations in medicine right now. It's really bad because the insurance company dictates what providers do. They dictate what the patient's able to get. If a patient has a deductible, that is a huge problem because the patient 9 out of 10 has to meet that deductible to get any treatment covered. Yep. So all of that is coming out of their pocket. And people don't realize that. They think, oh, I have great insurance, it'll cover it. But then you're paying for most of it. And if you're a healthy person who doesn't use the insurance, that deductible is never getting met. And then December comes around and you like need an MRI or something. You're paying the $300 to get the MRI.
It's crazy.
People don't get it. And there's no, even like when I was in school, they don't tell you any of that stuff. They don't tell you that.
As they should.
Yeah.
Well, then these doctors are expected to run their business or run their practice with no knowledge of stuff like this.
Yeah. And that's why there's an art to medicine and there's an art to it because it's a business also. Because you have to also handle things like before they become problematic. So like you don't want the patient to go into debt because you couldn't get their stuff approved and now they're behind, you got their stuff approved some way somehow, but now they're behind the 8 ball. That's not, everybody has, finances and stuff like that. And it's very difficult in the country to get stuff taken care of in a good fashion. Even though we are paying a lot of money for insurance, it doesn't always pay back, if that makes sense.
No, definitely.
Yeah.
Well, we're going to get into these churros with the cannoli dip, the infused cannoli dip.
Yes, we are.
We'll be right back.
You're listening to the Oven Podcast. Thanks for tuning in.
All right, so Chef Harry Poole at Jackson's in Comac kills it once again.
Yeah.
Another great guest, Morgan.
Thank you for having me.
We've mixed it up this time. The guests that are enjoying this infused meal with us, they threw some questions in the oven.
Instead of Mario's ridiculous questions.
I'm still asking you a ridiculous one. I want to. I'm not letting that one go. I'll say that for after.
I'm scared.
But would you like me to pick, or do you want to pick it up?
Yeah, someone else pick.
You want me to read it?
I don't want to be responsible.
I'll read it to you too.
Yeah.
This is the first one.
Yeah, we'll do 2.
I feel like after I read the question, I'm gonna be able to guess which table came from.
Yeah, I wonder where it came from.
Oh, this is first edible experience. Tell us about it.
When I was in high school, this is insane. When I was in high school, this guy that we went to high school with, he was selling pot brownies like out in the open, and he put them in like Panera bags, like so it was like Panera bread. And I bought one, I think for like $20. I was like, oh, I'll try it. And then like I was by myself and I was eating it, and I was like, oh, this is nothing. So then I decided to like go on a drive. Biggest mistake of my life. I went driving and I was listening to like, this is when the Kid Cudi album came out.
Oh, you were behind
I was driving. This is when the Kid Cudi album came out, and it was like Pursuit of Happiness. It was like, I was like, I gotta go home.
I gotta drive home.
Time to go. It was a lot.
I want you guys to know she's sitting over here in between courses, and she's like, "Yeah, we just, mic is on, but we'll cut this out." And she's over here telling us that she was driving high. So I don't know. Are we airing this or not?
I was like 16, I think. It was a lot.
What was your first edible experience?
Oh man, we were sitting in Suggs' basement. It's not as good as this. That was great. Remember Mike? I don't want to say his last name because I don't want him even watching the show. He used to make these, it was called space cakes. And, back then no one knew what the hell they were putting in it. Like they weren't dosed right. They were telling a story the other day, like they had what they thought was 80 milligrams, like how to go home. Like that was like, we ate 2 space cakes and I was actually a part of Suggs' couch. Like I couldn't get up for a drink. I couldn't get up to pee. And
like that commercial.
I was literally melting into the couch. And I actually hated edibles after that, like for a really, really long time. And then this started.
You found your calling, right?
You know me, dose right. Edibles are the way to go. I prefer edibles over smoking.
Definitely.
But I misdosed myself one time. I told you. This is not my first edible experience. I really don't remember my first edible experience, but
It's a good thing.
yeah.
Got a pro over here.
A few months ago when I was on my, my journey into cannabis, I got a little reckless one night. We used to have these gummies. They were like 60 milligrams total.
Oh my God.
So I would have half before bed. And like, if I really want to be knocked out and wake up good for work, I'd be fine. So it'd be like 30 milligrams. I got to the last gummy. I was like, I'm really going to leave half in there. And I thought it was a good idea. I thought it was a good idea to eat the whole thing. Oh man. When I went to bed, I literally felt like my bed was angled down and I was sliding off.
Oh my God.
I was like, what is going on? I was terrified.
Oh my
I was
God.
terrified.
That's an awful feeling.
Yeah.
No,
Just like
there's no escape. There's no escape.
number 2.
Question number 2.
What the hell is this?
I don't even want to answer that
How
one.
long have you guys been besties? How cute.
That's actually, and whoever
I'm
has,
just today.
Kim, was that you? That was you? How long have you guys been besties?
Oh, no.
Who asked that?
this is, whoever said it, great
You asked
handwriting.
that?
Great
Oh, how
handwriting.
That was a
cute.
good, great handwriting. Great
Great
handwriting.
question.
Oh, man.
So
God,
who said he's my best friend? I don't even like him.
I'm forced here. I don't know.
My mom pays him to hang out with me still.
If it wasn't for your brother, you'd have no friends. I would say just like 7th grade, 8th grade.
No, that's a lie. 6th grade. 6th grade.
Give him in the bag.
He made fun of me heavy in 6th grade. I was a little chubby in 6th grade.
Aw.
So now my best friends are they're my bullies growing up. How crazy is that?
Well, I helped him lose weight. So I got one last question for you.
I think we should do another one.
If we get another one, we'll do one
I
more.
think we should do
Let's
one
do
Yeah.
one more.
Because this
We
wasn't
the
for her.
rowdy bunch.
And then I'm still asking you.
Goodbye.
Should you masturbate with THC topical lotion?
I know Billy asked that. Got him.
Billy, Mario's actually keeping that for next round.
Yeah.
So,
We were all just discussing advancements on New York pot butter.
Oh
We're gonna
my
start
God.
using cream.
No, I was going to use the lotion and let you know.
Yeah. Let you get a taste.
oh,
Oh man, this is a good one. So this is a fuck, kill, marry. This is a good one. I like this. This is by Gio. Oh, go. He said go. The edibles are kicking
We have a
in.
little bit of a reading problem.
All right, so fuck, marry, kill. New York pot butter, vodka soda, or Coke.
What kind of Coke?
Yeah, what kind of Coke are we talking? Okay, the fentanyl kind. Got it. All right.
Kill Coke because we don't know what that is. Marry a vodka soda. We're gonna fuck New York pot butter.
let's go.
And
Let's
find out from Billy what's going on.
No, I was gonna say, like, let's say if you have celiac disease, right?
Mm-hmm.
If your partner eats gluten and you eat their ass, does that count as gluten free?
He goes, does that count as gluten free?
I don't know. Try to find out.
Well, I think we'll end up sitting here laughing all night, but it's got to come to an end. Another great night at Jackson's in Comac. Chef Harry Poole always kills it. Thank you for the
Thank you.
hospitality. Thank you, Morgan. You've been a great guest.
Thank
Can't
you.
thank you enough, and hope you join us again sometime.
Yeah.
Thank you guys.
And thank you everyone for coming. Seriously, this is awesome. We want to thank Chef Harry Poole and his team over at Jackson's Restaurant in Comac, New York, for another amazing infused meal. Make sure you check out our YouTube page, click the subscribe button, and join us next time, because there's always an open seat for you at the oven.